Welcome back. I'm the Intense MD, a double board certified intensivist, here to give you an inside look into the intensive care unit. This is the final video in a 5-video series all about heart health since it is Heart Month. At least this is the last day of Heart Month, which is February. So far, we've talked about the different types of heart diseases, heart attacks, broken heart syndrome on Valentine's Day, and a certain type of arrhythmia called atrial fibrillation. I figured it would be a good time to talk about some of the myths about heart disease and debunk some of them. And then at the end, I'll leave you with some tips on how to keep your heart healthy. As I've stated in previous videos, heart disease is very prevalent throughout the world. It is a major cause of disease, disability, and death globally. And while there is a lot of good information about heart disease out there, there are also a lot of misconceptions and misinformation about health information in general, but particularly about heart health. So today we're going to talk about some of the common ones, and we'll talk about why these may be not exactly true. It's important to know what the facts are because following misinformation can jeopardize your own health, or you might just not be aware that something very simple can affect your health in general. Myth number 1. Heart disease only affects old people. Well, old people is kind of an arbitrary thing because everybody considers a different age old. The United States, a lot of people consider people 65 or higher elderly, but heart disease can affect people of all ages. We talked about in types of heart disease video that there are conditions in the category of congenital heart diseases, and these are diseases that can affect someone at the time of birth. So it can go from somebody who is an infant, a child, teenager, 20s, up to what people would consider old. So it can affect the whole spectrum of ages. There are younger people who can have heart attacks, young adults, people in their 20s, 30s, and 40s, who I've seen come in with heart attack symptoms, have had coronary artery disease, and may have even had to have cardiac surgery at a younger age. So with this being said, it is never too early to start thinking about your personal health and your heart health. Myth number 2, heart disease only affects men. It is a man's disease. Women usually die of other causes, so they shouldn't be too worried about their heart health. Heart disease is indeed a leading cause of death for women in the United States. According to the CDC, in 2020, heart disease was the leading cause of death in women in the United States. They stated 1 in 5 female deaths were attributed to heart disease. The most common type of heart disease in the United States is coronary artery disease, and it affects 1 in 16 women over the age of 20. So it is important for everybody to pay attention to their heart health, not just one particular gender. It is equally as important for men and women. Myth number 3 is you are only having a heart attack if you are having chest pain, or that chest pain is the only symptom of heart attacks. There are many other symptoms of heart attacks, such as shortness of breath, fatigue, nausea, dizziness, or just feeling unwell. There is also a thing called a silent heart attack where you do not have symptoms. So it is important, if you have any concern that you are having a heart attack, even if you don't have the typical chest pain, to still get evaluated, especially if you have a history of heart disease in yourself or members of your family. Myth number 4 is high cholesterol levels do not cause heart disease. This is a fallacy that has popped up in my own comment section. Research has shown that saturated fat consumption increases your LDL cholesterol levels. This is the type of cholesterol that causes plaque buildup in your arteries, including your coronary arteries that are the blood vessels that supply the heart. It's important when you're visiting with your primary care doctor to check in with when your last time your cholesterol levels were checked and to see where you fall within the target ranges. Stress does not cause heart attacks. People who are under chronic stress have a rise in their cortisol levels, which is the stress hormone. There's also data that shows prolonged stress can cause increased blood pressure, hypertension, as well as increased heart rate. So having an increase in your stress level on a chronic basis can increase your risk of heart attack in general. If you're finding these tips interesting, don't forget to type the like button so I know that you want to hear more about these myths and more videos like this. And if you're ready for the full commitment, you can go ahead and subscribe to this channel. We're going to move on to talking about heart healthy tips. So these are things in general. They're not meant to be on an individual basis because I am not your personal doctor. These are things that you should discuss with your primary care physician or cardiologist. But in general, these are some recommendations made by the American Heart Association and other medical groups that are based on a lot of data and research. So the first one is something that many people have heard is to exercise on a regular basis. According to the American Health Association, they recommend 150 minutes of moderate intensity exercise per week. This can be broken down into 20 minutes per day or 30 minutes 5 days out of the week. Moderate intensity can be something like a brisk walk, anything that gets your heart rate elevated into probably about zone 2 if you're thinking about the 5 zones of heart rate. If you do more vigorous exercise such as running, spin class, anything that gets your heart rate into the higher heart rate zones, then the recommendation is 75 minutes rather than 150 minutes per week. And this is a minimum. So if you do more than 75 minutes of vigorous exercise per week, such as myself, since I do regularly train for half marathons and marathons, then that's okay as long as you are clear to do this type of exercise and you work yourself up gradually. You can also do a combination of moderate and high intensity exercises depending on the day, which is what many people do. Some people might go on a brisk walk one day and go for a run the next. Regular exercise has shown to lower blood pressure, keep cholesterol levels at bay, can also help regulate your blood sugar if you are pre-diabetic. Exercising on a regular basis has many benefits for your heart health. My best recommendation is if you do not exercise at all and you have not exercised in a very long time and you are unsure how much you can tolerate, to set an easy goal like doing 5 minutes of a brisk walk per day and working yourself up to the 20 to 30 minutes, or doing 5 minutes every other day and working yourself up. Because doing a little bit of something and working yourself up to the recommendation is better than doing absolutely nothing. Number 2 is eat a healthy diet. I am not a dietitian, and this can be very specific to different people, but what they mean by this in general is to eat a variety of fruits and vegetables, have lean proteins, try to avoid saturated fats, trans fats, and sugars. Many times people who have high blood pressure are recommended a low salt diet as well. Again, this is something that you should speak with your primary care doctor, cardiologist, or dietitian regarding for your individual needs. Tip number 3 should be no surprise, and it is to quit smoking. Smoking can increase your risk of many different disease processes, and heart disease is one of them. It can increase your risk of heart attack, stroke, and of course, different types of cancers. If you quit smoking, over time, your risk reduces back to what it may be if you did not smoke in the first place. So if you've smoked for a long time and you think there is no point in quitting, that's not true. If you need assistance with quitting smoking, there are a lot of nicotine replacement options and other medications that you can discuss with your doctor. Tip number 4 is to limit alcohol consumption. Of course, abstaining from alcohol is the best solution, but the recommendation is for women to consume no more than 1 drink per day and men to consume no more than 2 drinks per day. Many people think about alcohol and liver disease, but alcohol can also affect your heart. There is a condition called alcohol-induced cardiomyopathy, which decreases the efficiency of your heart pumping. So long-term alcohol use, especially high levels of alcohol consumption, can lead to significant heart disease. Tip number 5 goes back to the final myth we talked about, but it's to manage your stress level. And obviously, this is easier said than done. This does take some time to learn what works for you personally, but there are many different methods to use to decrease stress. Some people find exercise on a regular basis to decrease their stress levels, meditation, deep breathing, yoga. There are multiple meditation apps and videos on YouTube where people will go through a guided meditation. Some people find journaling helpful to reducing their stress. So this is a matter of finding which modality works best for you. And the final tip is to get enough sleep. Sleep is very important for your health in general. Getting enough sleep in general can improve many aspects of your health, but heart health is certainly one of them. The typical recommendation is 7 to 9 hours of sleep per night. This can vary person to person, but the recommendation is to get at least 7 hours. Obviously, in some situations, this is not possible for everyone to get a full night of 7 hours of sleep. Naps do count towards your total sleep. There is an entire field of medicine called sleep medicine. So this is a complex topic. If you're concerned you have any type of sleep disorders, this is something you may want to speak to your physician about, because there are some remedies to sleep disorders such as obstructive sleep apnea that can be very disruptive of your sleep overnight, insomnia, or even just having an elevated stress and anxiety level that is disrupting your sleep. Limiting your electronic use, screen time, blue light exposure, vigorous exercise, and eating before bedtime are just a couple tips and recommendations to improve sleep quality. Thank you for watching this video till the end. I hope you enjoyed it. If you want to hear more health myths and tips, please leave a comment below and let me hear what topics you want to hear about next. Don't forget to subscribe if you enjoy critical care and health content, and look for my video next week. We're trying something a little bit different in terms of topic, but if you enjoy next week's video, we may turn it into a series. Look forward to seeing you then. Bye!